That's a very emotional song. I feel very emotional.
I don't know what that is.
Hey everybody, this is Dr. John Quinn.
It's Dr. Mike Tarnovetchi.
Welcome to Beltline Talk. You definitely have different music in your car than I'm going to have in my car.
No, I honestly don't know what this is. So I got a question last week, and it was something that I had to think about a little bit. Somebody asked me, what exactly is physical therapy? I know there's a lot of people have a lot of questions because there's a lot of other fields, and they're not really sure what a physical therapist is or does specifically. So, it took me some time to think about that. What would you say, in your opinion, what's a physical therapist?
Okay, I'm going to get real sciencey first. I feel it in here, man. I feel it in here. I remember one of the mentors that we had, and he was a professor, taught the doctorate program. He used the definition that we specialize in neuromusculoskeletal dysfunction and treatment and rehabilitation of those dysfunctions. I kind of feel like we're having a moment, I would say to the layperson, we are movement specialists that deal with problems. The big time, I would say, it deals with the prevention of injury and also rehabilitation of injury to any of the systems associated with the movement system. So that, I guess, is a broad stroke way of what I would say what physical therapy is. This isn't a moment. You don't feel something right now. I feel like
I'm embarrassed. I'm embarrassed. I don't know what the hell this is.
How would you answer that? I kind of gave you a full, huge answer. So what is physical therapy?
I have nothing to say. I guess for me right now, I think a lot of it is really understanding movement science and applying, the neuroanatomy to that. I know obviously the neuromusculoskeletal kind of ties into what you're saying, but yeah, for me it's kind of just really addressing that dysfunction, if there is one, and taking that and kind of identifying how can we either prevent or sort of rehabilitate and make the injury or the rehab process a little bit quicker. If there's something wrong with your car, you go to the mechanic. If there's something wrong with the way you move, you go to PT. You know what I'm saying? So
sure.
We don't change your oil, but
I think the biggest part, the biggest fallacy when it comes to physical therapy, I would turn here. The biggest fallacy is that you get hurt and then you come in and you see a physical therapist. That is like 25% of what we do. The biggest part of what we do is the preventative portion of it. What is the biggest preceptor for an injury? What's the number one preceptor for an injury? Previous injury. More studies show that than anything else when it comes to athletes, lay people who hurt themselves at work. So we work so hard for that. And that's why direct access is awesome, because it allows people to come in when something doesn't feel right or they have challenges. You have people that come in and they say, I want to make sure I can do this activity longer, so I want an examination that way. And I think the more that we broadcast that, the more that we educate, the people in our community about what we do and who we are, I think you'll find that overall, a lot of people will be a lot healthier and they'll be living longer, doing what they want to do. Ooh.
Sorry.
New Jersey driver. See?
It's not marked if it's a one-way.